that we've got about 105 or 110 also joining us live on YouTube at very short notice that we've given you. So just goes to show how much this topic touches the heart for every single one of us, literally, both in terms of topic and in terms of the content. So just a bit of housekeeping for those who are in Ekta Center. Can we just have a show of hands who's here for the first time? Okay. A special and very warm welcome to all of you, and hope you enjoy tonight's talk. Bit of housekeeping for this evening. So in case of a fire, we have no fire drills in plan. So there's some fire exits that we have, 2 on that side and 1 behind you. In the dining area, we also have 2 fire exits and also the main door, which will also act as an exit. We have the gents and the ladies' toilet and also disabled toilet on as you get past through those double doors there. But all of you are here more to listen to tonight's speakers, and we are very privileged and proud to have 3 very, very, very distinguished speakers. I'll introduce them in order of which I think they'll be speaking. One of them is Dr. Puneet Shah. Dr. Puneet Shah is a dentist by profession, and he's got a young family. And at a very young age of 35, he experienced heart disease, i.e. what we call a heart attack. So it's going to be a very big eye-opener for us to understand and not be able to take this situation for granted. And I think it'll be very interesting to hear what he went through and what advice he can give youngsters in particular. So we look forward towards hearing that. The interesting fact with Puneet is that his father was a dentist. He's a dentist himself, and he was also a family dentist to us. And he was an incredibly, incredibly good swimmer. We both used to study together. So I do know of his abilities in terms of cardiovascular exercises. So despite that, he did go through what he did go through. So it'll be very interesting. And thank you very much, Dr. Puneet, for your time. We also have Nishad Gupta. Nishad, interestingly, went through a very unusual experience very, very recently. He didn't quite have the heart attack, but when he went for some diagnostic random testing, it was found that he had some clogged arteries, and I'm sure he's going to share some stories. Eventually, he needed to have a procedure. We're very fortunate to have Nishad because it's a very live experience, and he will be able to share far more about what we should and should not be doing and what we can actually care for. The interesting fact between me and Nishad is we had so many wonderful, beautiful collaborations when he was president of the Young Jains organization. So community work is the heart of what he does. So we're very privileged to have somebody like Nishad by our side this evening to share that story of his. Of course, as far as the clinical side of things are concerned, we've got the best of the best as far as a person who's possibly set the highest standards, clinical standards in our community, and that's Dr. Ameet Bakhai. Ameet, if you Google, I will not tell you about Ameet's qualifications, because if you just Google it, it's a list that can go on and on for a very long time. But he specializes tremendously, and he's very passionate about research and development. But I think what puts Ameet and why so many people have joined us together, and why I receive so many calls just within a period of 6 hours, and I'm getting calls as I speak right now, is because he's got a very different approach to the medical side. Yes, science is one thing, but how you approach it is a different thing. And the way he connects with people is astounding. I know because I'm a close friend of his, that he has people coming from abroad just to make appointments, and they only want to see Ameet Bakhai. And I think what sets him apart really is his spiritual efforts that he's made within his own self, which helps him to connect with people at a level that they themselves have not realized. So he helps people to see and think different from outside the box. And that really, really touches the hearts of people. But enough of me saying all these things. I think I would like all of you to experience this yourself. Before I call Ameet Bakhai on stage, Jay, did you want to say something? Oh, yeah.
Just fire exit, just in case there is a fire, then to exit.
Oh, yes, I've mentioned it.
You
Yeah, I've mentioned it. Yeah, that's right. Yes, exactly. That's Jayshree, our Northwest Chair. And in case any of you don't know me, my name is Nehul. I'm the Vice Chair for the Northwest area. So very welcome here. And please, just a big round of applause. Can I hand over to the speakers in whichever format you wish to do this? Yeah.
Nehul, thank you so much. And especially for managing to have this blue light in front of you. So beautiful. You've set a really interesting task, which is to think outside the box. And thank you everyone for coming today, making the time online and in person. And it's wonderful to see the hall so full. And it's also very nice of us, Oshwal Association UK and all of the other community groups that are doing so much. The NHS is an amazing organization, one of the world's best organizations, but it is under considerable strain after the pandemic. A lot of us have not had a chance to use the pandemic to get fitter. Some people have, and that's been really noticeable. For the first time, they've had more time at home. They haven't had to commute. They've used it in exercise. They've used it to connect to their family. They've used it to connect to themselves. And so some people have really benefited from the pandemic's ability to work remotely and use the spare time to invest in themselves. Others have not had that chance, have not had that motivation. Much more heart disease, much more diabetes, much more high blood pressure, much more kidney disease, much more depression, hugely much more anxieties, not just amongst people, but amongst NHS staff. And those things are putting so much pressure on the NHS that there is no obvious way out. But there is a way out. There is a way to understand this. And today, the stories that Punit will share and Nishad will share will show you the power of being reactive with medicine when the fire happens, to being proactive with medicine to make sure the fire never happens. And so some of the key things that we're going to take away today, number one, who does heart disease affect? Who does it affect? Nehul, who does heart disease affect? Asians, absolutely. Hence two Asians stories. Yeah, personally, who does it affect personally? Everyone. Can somebody build more on that? Everyone. Really? We all have a heart. But if you have heart disease today, who will it affect? Excellent. It will affect you. It will affect your family, your brothers and sisters, because they share genetic traits with you. It will affect your parents if they're alive. But much more importantly, it will affect your children. Your partner, of course, because they've got to bear the burden. And they will get heart disease a few years later because they share all of the same stresses and lifestyle exposures that you do. They're not escaping. It's only a few years between. But the most important thing about today is by acting today, and it's never too late, you will not only help yourself not get heart disease, you will reduce the risks genetically of your children getting heart disease. Now, nobody minds getting heart disease. Get this, nobody minds getting heart disease because it's now very fixable if you arrive in time. What they mind is dying of heart disease unnecessarily. And we do today in London, in the UK, don't expect to die of heart disease. We are very good at managing cancer. We're even better at managing heart disease. And we were shocked that the COVID could come along and kill some of us with all of our technologies. And yet it did. 30-year-olds, 40-year-olds, 50-year-olds. The morgue was so full. For the first time in 30 years in the NHS, we could not find space for people to be placed when they'd passed away. We had to get freezer vans for the first time ever. And yet, every single year, more people die of cardiovascular disease, heart attacks, strokes, arrhythmias, aneurysms, than they do of COVID. More people die of cardiovascular disease, the number one killer in the West, than they do of COVID. And that's been going on for decades. And so the one thing I want you to think about is, how do you go from waiting for that heart attack to never letting it happen? And that's your job today. Of all the things we're going to tell you, I want you to take the responsibility for yourself, your partner, and your children. How will you prevent yourself and your loved ones getting heart disease? And how will you save the NHS that is crumbling on its knees because we're having to deal with us not preventing enough heart disease? That's a simple question. And you're going to answer that at the end. We can even prevent diabetes. We can remit and reverse diabetes. Salim Yusuf, one of my greatest professor mentors, did an incredible study. He said, if today all of us went back to our villages and we gave up our cars and we had to walk everywhere, 75% of our risk factors for heart disease will vanish within a few months. If I had a twin brother living in Rajkot, living on the outskirts of Rajkot, living a simple life, he will never get heart disease until his 80s or 90s, if ever. His cholesterol will be half of mine without taking any medications. We have caused our own problems by making the choices of where we want to earn a living, what education we want for our children, what access to services we want. But we can make better choices, which is to heal ourselves internally of needing more and more and more, and actually discovering what's inside of how amazing our technologies are. And guess what? 80% of the time, you won't even die of a heart attack if you're calm about it. Your heart has amazing functionalities to repair itself and to arrive at the hospital alive. And 80% of people just have to press 999 and they will survive that journey of a heart attack. They'll survive the journey of a stroke. It's only that 1 in 5 at the moment, so unaware, suddenly hit, haven't got the resilience to cope with life's events, such as heart attacks and strokes and infections, and they are in trouble, and we need to help them. We as a community need to find people that are at risk and say, can I help you go for a walk regularly? Can I help you be better, particularly in the winter when their infection will occur and it will kill them? And that's because we haven't taken the care to make them resilient to everything that's going to happen in London. Nothing in London is new. We know exactly what's going to happen. We know who's going to get prostate cancer. We know who's going to get breast cancer. We know who's going to get bowel cancer. We know who's going to have stroke. We know who's going to have dementia, diabetes, cholesterol. Nothing's new. And yet we pretend it's the first time this has ever happened. Oh my God, it's happening to me, because we didn't invest. There's no A level in prevention. I want you to turn that around. I want you to use these events to be a masterclass in prevention. With that, I'm going to stop the scene set. You're going to hear amazing 2 stories. Punit, the hot fire, got through it. The emergency, fantastic. Nishad, wow, how did that happen? And how did we avoid it? And I want you to think about where is your journey in that. So I'm sorry it's a hard ask. I'm sorry I'm being really serious. I'm sorry I'm being tough on you. But that's my job, to give you tough love. With that in mind, thank you for coming.
Thank you, everybody. I'm not going to give you any tough love. And I'm going to keep it quite simple. But first thing I'm going to say is I'm not a doctor. I'm not a GP. I'm a dentist. And I'm not as clever as these guys are. So if you ask me about teeth, I'll tell you. If you ask me about anything else to do with medical stuff, anything else to do with medical cardiology, especially cardiology, I may skim over it. My task today is to let you all know how I went through it and what I did and how I changed myself. It's unfortunate what happened, but it did happen, you know. I'm going to make this interactive. I have no slides. I just want to make it interactive. Show of hands. How many of us want to have a heart attack? Come on. Wow. 1, 2. So people ask for heart attacks. 3, 4. You all want to have heart attacks? Right. Let's ask the women, or let's ask the men actually. How many are married actually? How many are married here? Right. Okay, hands down. Let's ask all the men, how many times a week does your wife give you a heart attack? I'll put 2 hands up, right? It's easy to laugh about it, but it does happen. And I'm not joking about it. It's stress. It's stress at home. It's stress at work. You come home, she goes, "Vasan tu aja." Yeah, and you think, oh no, I've still got to do paperwork, you know? But it's the reality of life, and things have to happen. My story began, actually, do you know what 9/11? Everybody's heard about 9/11. Mine was 9/11. Okay, 9th of November, 2009, 9/11. But it did, do you think I had a heart attack on 9/11? Do you think it actually, heart attack said, oh, today I've chosen you, you're going to have a heart attack? It didn't happen on 9/11, did it? It doesn't choose me that day. My story of a heart attack began when I was a kid. It began when I was a kid. You know, I've had jalebi gatia, I've had maru bhajia, I've had everything you can think about. And we all do that without thinking twice. Gatundu's chips, Johnny 11, yeah, everything. All that accumulates over the years, right? You might be lucky and get away with it, but not everybody is. Yeah? And when you're lucky, at some point it will hit you. And there has to be some factor in there that's going to tell you, okay, I'm coming for you now. So 6 months before my 9/11, I started getting stomach pains, real stomach pains. And come on, I'm 34, 35, 33, whatever. And I'm thinking, it's stomach pain, you know, chili khadushe, you know, Gaviscon, here we go. Every time I can take Gaviscon, it's fine. It's okay for a few hours. So I became a Gaviscon addict, right? And then thinking, okay, this is it. It's going to happen. No problem. I'm fine. One day, I'm at work, and all of a sudden, I don't feel so well. I really don't feel so well. So I've still got to go and get my kids, who are little, who were 4 and 3 at that time. So I go and get my kids, come to bed, come to house, get in bed, put my kids in bed. And I'm thinking, not feeling great. So what happens? I call my wife, who's at work, and say, can you come over? I'm just not feeling well. So she does. She looks at me, she goes, let's go to Barnet. We go to Barnet. What happens at Barnet? Typical, you're 30, you're a young guy, you look fit and well, did my blood tests, whatever. And they say, you're fine, go home. Okay, I'm going home now. Never in my wildest dreams am I thinking, I am going to have a heart attack. Would you have thought that? No. Tell me one thing I was doing wrong in all these years since I came for I think maybe 5 years before I had my heart attack. Tell me one thing that I think you all know that you should never do. Sorry? Hang on, no. I was doing a lot of exercise. I was a swimmer. I was a very good swimmer. I climbed Mount Kilimanjaro at the age of 16. Right? I was very good in exercise. Sorry? Yeah, I was getting stomach pains. Of course. But what's the one thing a lot of people do to get rid of stress? Smoke. Who said smoke? See, my sasu knows. Yeah. Because I used to go and have cigarettes with my sasra, right? Behind everybody's back. You don't want to tell anybody. So we just walk out, dukhni waat kari and a cigarette mari. Right? That was the one thing I was doing really wrong. I wasn't a heavy smoker. I was not a heavy smoker. Right? I was probably smoking about 2, 3 a day, but you don't have to be a heavy smoker, do you? Right? And I used to dread my wife finding my cigarettes because if she did, she'd put them underwater, she'd flush them down, she'd do everything. There was once I brought an outer from Kenya, right? And she found them, she soaked them and put them in the bin. I wish I'd listened to her then. But anyway, so what happens? I don't go to work the next day. On the Saturday, somebody calls me up from the practice and says, look, Mr. Shah, all these patients you've missed for 2, 3 days, you've got to come and see them. I wish I'd never listened to her. Because patients will come and go. People will come and go. Relatives will come and go. Your health will not. Yeah? Anyway, young, energetic, thinking nothing in this world is going to ever affect me. Nothing's going to stop me. Ambitious. Whatever you want to do. I go to work. But there's one thing that I missed. There's one crucial thing that I missed. And I wasn't thinking about it then, but I did now, and I have done ever since, is that there's always, I don't know how many of you believe in this, but there's always somebody else out there who's looking after you. There's always somebody looking after you. And that one day, as I was going to work, my nurse called me and said, I can't come to work, I'm too tired. On that Saturday. So I called the receptionist and said, just get a locum nurse in. I'm coming, it's half a day, get a locum nurse in. So she did get locum nurse in. And the whole of the morning, I worked, patient comes in. I've seen a couple of faces here. I think I have recognized you as patients, but there we go. So if you're on that day, I'm really sorry. But I just, all right, chair, chair, yeah, I'll come back next week, whatever. I just want to get rid of them quickly. The last one comes in and needs a tooth out. And I'm thinking, okay, karinaku, then I'll have to go home anyway, right? I can go home and rest. The minute I took that tooth out, I fell down because of the stress and the pressure. And I knew as I was falling down, I was having a heart attack. Now, think about this. I said, somebody is looking after you, right? The week before, we had basic life support training in the practice. The week before. And the guy who came to give us basic life support in the practice said, you guys need to get a DFib because we're a big practice, we do all kinds of stuff. You need to get a DFib. It wasn't regulation to get a DFib then. But now, and correct me if I'm wrong, if you have a heart attack in a practice, the ambulance doesn't prioritize you because you have all the necessary equipment in that dental practice or medical practice, right? Now it is, the rules have changed. But at that time, we were one of the lucky ones. We had a defib. But my more important lucky part on that day was that the locum nurse turned out to be an ex-cardiac nurse. Think about that, right? So the minute I fell down, she knew I was having a heart attack. She called the ambulance. She gave me some medication, and she called my wife, who coincidentally was at my neighbor's out with the kids and left the kids there and ran off to see me. It doesn't stop there, right? Because she, I mean, I have to say this, don't I? She's been the backbone, right? And my sister and my mom and dad and my brother, everybody. Everybody around you at that time has to be a backbone. And psychologically, you're screwed. Because you're down in the dumps. I had a heart attack. I'm being taken in the ambulance. If you ever had a heart attack, things go through your head you've never even thought about, right? And you can feel your whole body going numb, totally numb. And that happened to me. And I was being put in the ambulance. My whole body was going numb. The only thing I could say was, "Maafi kar dejiye mujhe." That's it. That's all I could say to my wife, who was sitting next to me. And turns out that the ambulance lady, that was her first ever heart attack, right? They'd never had a heart attack before. And they were saying, "We need to go Royal Free, we need to go Royal Free," remember? And on the way to Royal Free, they got lost. It can't get any better, can it? Somebody's trying to pull two strings on either side with me. Anyway, that's my story. Went to Royal Free. Luckily, I had an amazing, I mean, all these cardiac surgeons, I don't know how they live. They are there 24/7. They're superior human beings, I think, right? I had an amazing team. We joke about the NHS. The NHS has, I think, the best emergency service in the world, right? If it was not for the NHS, imagine if I had this heart attack in Kenya or on holiday or somebody, I wouldn't be standing here right now. Anyway, they did what they had to do. They made me scream. They put a stent in me, and they said, "Now it's your choice. You either live a life or you don't live your life." Right? Psychologically, you're sitting there and you're thinking, what am I going to do? What am I going to do for the rest of my life? So obviously, I mean, the first thing is stop smoking, right? Which you did, obviously did. Make changes to your lifestyle. Give up all these little ghee, tel, I'm not saying you should give up completely. Obviously, everybody has a day when they need that comfort food. You want to go out and enjoy yourself as well. You've got to live a life, but you've got to be very, very, very controlled about it. Yeah, everybody's ambitions. And for the first 3 months after the heart attack, I was depressed. I mean, I was seriously depressed. Yeah. And I'm not kidding you. I didn't know what to do with myself. Until one day, Hasmukh uncle came, who's passed away, unfortunately, right? And he came and he sat down with me and he said, it's not that bad. You live, right? I remember my mom and dad and my sister and sister sitting with me and saying, you've got young kids. You're not dead. Get on with it. Life moves on. Life carries on. Make some lifestyle changes. Fast forward, and I psychologically, my wife, and I have to thank her immensely for this, helped me out. She's a dentist as well. she took over so much of the burden. We actually moved on in life. And yeah, fair enough. We've done well as dentists, and you progress in life. Your kids grow up, but you take everything at a stage and a step. And even now, if I go out for a few drinks, which I do with Niraj, right? I should be awake till I get back home, right? And wives do that, don't they? Right? And she'll tell me off. But that's her job, I guess. So fast forward 10 years. I know I'm running out of time. A few more minutes. Fast forward 10 years, and COVID time hit, and I was told you've got to have regular checkups, regular not endoscopies. See, I told you I'm not a doctor. Echoes, and about 10, 11 years down the line, right? I wasn't feeling well again. So I called up. Luckily, by this time, I knew some cardiac surgeons, It's always good to know cardiac surgeons, I promise you, right? And went in royal free. 2 more stents, please. It's like, you're collecting stents now. You're buying them. And I did. I had 2 more stents. And all the things I do, all the care I take, it's never going to leave me. But all I can do is say, okay, I'm going to look after myself the best I can. And then the rest is up to what's going to happen. Obviously, you believe in it, you have faith in it, and you make lifestyle changes. If you make lifestyle changes now, it's going to rub onto your kids and onto your family, as he said, and it's going to make things much more better. Yeah. I'm going to stop there and leave. Ameet.
I just wanted to thank you for that incredible authenticity, humility, and insight to our life, to your life. And saying the truth, and this is something that Nishad and I were talking about, there comes a point when the truth is so strong, you can't ignore it. It leads to behavior change. And that's the beauty, that when you've been given that second life, please use it for that behavior change. But as Nishad is going to show you, you don't have to wait for second life. There can be signals, there are signals, there are people looking after you all the time, that if you listen to those signals, things will happen at the right time. Thank you, Punit. Nishad.
Jai Jinendra, everyone. And I think I echo some of the messages there. So forgive me if I duplicate anything, but I think you touched on a really important point there, which is the emotional impact of any kind of illness. Please do not underestimate that for not just the person, but those around them as well. So, as I've been introduced, I'm Nishad Himatlal Gutka. I'm 51 years old. 7 weeks ago, I was doing the things that I'm sure many of us were doing 7 weeks ago. Going back and forth from work, enjoying socials in the evening, and playing the odd game of badminton. 3 weeks ago, I had open heart surgery and a coronary bypass. That was done on April the 25th. I'm going to share some of the moments leading up to that journey or to that date. And I'm going to, at the end, just give 3 takeaways, which I hope you will find useful. I'm going to speak purely from a patient perspective. I don't have the medical background as my colleagues here do. Do you remember, let's go back all the way to 2022. Do you remember that extremely hot spell we had where the temperatures soared to 40 degrees? Do you remember where you were and what you were doing then? It's incredible, wasn't it? That weekend, I was attacked and stabbed in multiple places by a random stranger. Thankfully, I recovered. I survived, I recovered, and over a period of time, I got back to normal, and there weren't any lasting consequences. However, it was that moment that made me realize that in life, there are things that you can control and influence, and those things you simply cannot. I could not have influenced or controlled what happened during that hot summer evening. However, the impact to me and to my family could have been even more serious. At the same time, when we look at our health, there are aspects, not all aspects of health, but there are aspects of health we can predict, we can influence. So at the beginning of this year, I made myself a commitment. It wasn't a New Year's resolution, it happened much later than that. But I made myself a commitment to be more proactive about my health, to understand the state of my body, but most importantly, to listen to my body, the signals it's giving out, because it's easy to ignore symptoms, no matter how minor. Punit was just talking about the stomach pains, right? So I had a series of lots and lots of blood tests. I had a very understanding GP, by the way. I had lots and lots of blood tests, lots of ultrasound scans, especially around here, because that's the area that was impacted, just to make sure things are okay. Unfortunately, everything was fine. All came back normal. We then moved into the heart. Not into the heart quite literally, but towards the heart. And again, some more blood tests, and I'm sure Ameet will share some of those blood tests in terms of what is looked at. And one test in particular was an echo stress test. So this is where you get wired up to an echocardiogram, as you would normally, but you're on a treadmill. And that treadmill goes faster and faster and higher and higher. And gets really, really tough at the end. It's great for the ego, by the way, because if you manage to finish it, you think, wow, I did that, right? It was probably the only exercise I had for 2 years. Joking aside. The results came through of that. And it was actually Ameet to talk me through the results. And he looked at the chart and he said, look, yeah, this is your heart doing this and it's behaving normally. It's doing everything you would expect as it goes higher and faster and so on. So yeah, looking good. However, there's a little blip, literally a small blip, just at the end. And it looks so odd. That was the signal to say, let's try and understand this bit better. Because that's something the heart is telling you, you put it under stress, and it's saying, ouch. That's my interpretation. So we did a CT angiogram. And in the CT angiogram, to be honest, I was quite relaxed on the day of going in. Why? Because I did not expect them to find anything. And I was looking forward to that. And I knew this would be the ultimate test. And then we're done. That was done in the morning. In the afternoon, later that day, Ameet called me up because he'd received the results. And he gave me some good news and some bad news. And there was genuine good news. It was unusual. I had an extra artery in the heart. I was one of the 10% of the population that has an extra artery. The bad news, my frontal artery, which supplies oxygenated blood to the heart muscle to keep it pumping had at least 2 narrowings, significant enough to require invasive surgery. And the next step was, well, before I go on the next step, I think I also remember saying, well, hang on a sec. And this is just a test, right? But I'm not feeling any chest tightness or chest pain. So can't we just leave it? Right? Because I'm fine. He explained that if this had not been detected, then I would have either experienced a significant cardiac arrest because it's the frontal artery, or I would have had severe heart disease over time. Both of them extremely serious. So that was the sobering moment, which said, you've got to do something. And the do something is, the next step is a coronary angiogram. And at the same time, they would probably do stents, as Puneet described. I went for the angiogram. A lovely guy called Dr. Devon did the angiogram. He was ready there with the stents. It's done under an operating theater condition, and it's done under local anesthetic. So you're lying there and you can see everything around you. And most importantly, you can see a screen that size, which is the computer screen showing everything that they see as they feed a wire into your wrist. And that wire explores your heart and all the vessels. And you see the camera and what the camera is looking at. Because you're awake, you're under local anesthetic. It's such powerful and clear technology. You mentioned Jalebi Gatia. Next time, I have a copy of it, of the results. So next time I'm tempted by chicken or extra portion of Gatia, I just need to open my phone and have a look at what's good and what's not so good in my heart. And maybe that temptation will subside. Moving on, Dr. Devon at that point said to me, yes, it is as we expected, but we've also found a third narrowing, which is also significant. He also said that he could do stents and they would work. However, that may not be the best option for me in the long term. And I wasn't too clear on what he meant by that, and I'll explain that in a moment. A few days, so what he said was he would go to a multidisciplinary team meeting, and all the experts would discuss this and decide and recommend. So it's a collective decision amongst the brilliant experts we have in cardiac and anesthetic type situations. I got a call after that meeting, and he simply said, the best long-term outcome, because of your younger age, not many people say that, as you can see with some gray hairs creeping in, because of your age and because of the fact that you don't have any other underlying health conditions, is open heart surgery to do a bypass and change a branch. We talked about the emotion. Puneet talked about the emotion. The remaining few weeks are tough. I admit that. It was the scariest time, even more scary than the incident a year ago, because of everything you're thinking about that could either go wrong or what your future life could be. On April 25th, I had open heart surgery. The frontal artery was bypassed and a new branch was added or grafted. Just before I finish, I'm going to share 3 takeaways. The first takeaway is there has never been a better time. There's never been a better time in terms of technology. You can get technology which you can have on your phone or at home to monitor your own ECG as and when you like, and lots of other things. There's technology in operating theaters and hospitals that give you such a clear view. Behind that technology is expertise of cardiac surgeons and consultants. Their expertise is backed up with decades and decades of cardiac cases. It is a complex area, but it's so well understood. I'm going to add something else into this first point. Many of those cardiac consultants and surgeons are from the Indian and Kenyan communities. Why is that important? That can be important because they understand our background, they understand our situation, and they understand also the type of lives we lead. Not just the type of food we eat, but the type of responsibilities we have. That was number one. Number two, there has never been a better time to act now. The younger you are, statistically, the less conditions you're going to have. I'm generalizing. The younger you are, the less other conditions you're going to have. So if you identify something early enough, your recovery time has the possibility of being even shorter. Your longer term outlook for that condition has the potential to be better. Because as we all get older, and that was one of my objectives, I knew as I got older, naturally other conditions would follow. The last thing I wanted was a pile of conditions, which then made me, that stopped me enjoying time with my daughters, with my family. So whatever your motivation is, find it. My motivation was simple. I wanted to spend more time with my family, especially after this experiences I've had. Find your motivation, act now, detect it, do something, and recover well. My final point is be open. It is, as patients, it's our responsibility to make sure the medical professionals see us not only as patients, but as people. So be open to them. Don't just talk about your heart. Don't just talk about your ailments. Make sure they understand a lot more about you because they want to. Professor Rakesh, who operated on me, he asked a very powerful question. He said to me, before we do this operation, tell me, what's your wife's health like? He asked that question after I had just shared with him that I have two daughters, very lovely indeed. We have a lot of joy together with both of them, and one happens to have Down syndrome. So he got it. He got, this is more than just a heart operation. My final point on being open is, as Asians, I think it's wonderful that everyone is here, everyone's on live streaming, and we're all really conscious about knowing more. But for many, when something like this happens, we tend to hide away and we tend not to talk about it until it's sorted. It's nuts, isn't it? The communities are organizing all these great events. There's a fantastic June 11th event, a health event going on, etc. I'll just share my experience. I didn't actively put it on WhatsApp, but whoever I met, if I had the energy, I would speak to him about it. I guarantee you, 1 out of every 2 people, 1 out of every 2 people actually shared an experience they had back. And that really helped. So there has never been a better time to act now and just be open. Thank you.
I'm honestly humbled by the beautiful stories that have been shared. And I know there's so many more in the audience. All of us have got stories. And I think this idea of sharing is probably the greatest idea, that you don't have to carry the weight on your own. But we have to move from being reactive to proactive. We have to help each other stay fit. And what I really want you to appreciate is how wonderful it is to know that when you've been given second chance, that you use it. And there's a saying amongst cardiologists. There's two sayings. There's a joke saying, there's only two types of people in the world: those who've already got stents and those who are waiting for stents. So that's the joke side. But the other side of that is that we are stronger after our first heart attack than we were before. All you have to do is survive it. Once you've survived it, you're stronger after than before. The chances of another heart attack killing you is less. You're on the right tablets. You're aware of the symptoms. And inside your heart are natural technologies that says, I've been here before. You can't scare me. I'm not going to overreact. I'm going to relax. I'm going to get through this. The mind and the body are so connected. Many of you will have heard other people's stories that have said, I just decided I'm not going to die today. I just decided. And that's true. We can influence our blood pressures and our heart rates and our oxygen levels, our endorphin levels. And just as we started off with Punit actually talking about the stress at home, we can do the opposite. We can hurt ourselves when we choose to do that. And we're very good at it. And so a couple of behavioral things is I'll show you scans. I'll tell you about all the wonderful medications. I'll tell you about the procedures. But even despite everything I will share with you, which is huge amounts of depth and knowledge, the most important thing is that your life and the way you react to any event is always in your control. And I think that's another interesting reason why there's so many Asians in heart disease management. And also why so many Asians, despite getting heart attacks at a young age, still survive because of the good karma that we bring to other people. The good karma that you've done of looking after that last tooth. There is always good karma. The family, you've looked after so many people. Yes, of course, we earn funding through that. Yes, of course, we get a salary and sustainability in the house. But we go out of our way to look after each other in so many small ways. That comes back to you when you need it. So remember that. You were told about there's always somebody else looking after you. You were told about listening to yourself, your body. These are really old Jain concepts that all souls are interdependent, that awareness is the most powerful ally that you can have to live a great life. So with that in mind, I'll now move, if we have time, towards a little bit of slides to show you some of the arteries and the tests. And we've got questions from YouTube about how to strengthen your heart. And that's great. Just hang on to that for a sec. Brilliant. So very quickly, you've heard about some of these technologies. So royal free, we're blessed that London is the safest place to have a heart attack in Europe. It is Brexit's loss that they've lost London, but it genuinely is. Our average, we have a 90% chance that if you dial 999, you will be at the cath lab table within 45 to 60 minutes. A 90% chance that we will have got the angiogram done, and we will usually have a stent within 90 minutes of call to balloon times. And we know exactly that technology. Imagine that, call to balloon time. We've been measuring that for decades. That is the way we have created these services around London, these super centers. You will bypass Barnet if the ECG is abnormal because the ambulance will take you straight to the cath lab. So it is one of the most wonderful places to survive a heart attack. We're getting better with strokes and aneurysms, many things. And so I'll just take you through. These are the arteries of the heart that we were talking about, Punit and Nishad were talking about. We often have three arteries, one at the front of the heart, which is going down the right-hand side, the right-hand coronary artery, which is in the middle of the screen here, over here, which is the front one, you can see this side. And at the back, in slightly lighter orange, in fact, I've got a mouse, so I don't know why I'm trying to put the screen. Here is the circumflex artery that goes around the back, but the most important one is this left main stem and front artery here, left anterior descending. And the reason we get a lot of disease here is because that area is taking the highest blood pressure. And so if you have high blood pressure, calcium will start building up on the outside, and on the inside, the little lining will start getting micro breaks. And you'll build up atheroma and cholesterol. And if you have diabetes, you'll build up sugar. And if you're not exercising, you won't clear it. Here is another, this is the inside of the arteries with catheters going in. And under X-ray, this is an invasive coronary angiogram. And what we've got here is a catheter, a plastic catheter. We've put it in from the leg here, going over the arch of the aorta, going over your chest, putting itself into the top of that right coronary artery and putting iodine dye in to find out if there's a nice, beautiful tree, a branch that looks pristine and it's got natural narrowing, natural reductions in caliber, just as branches come off. And this is a normal angiogram, right coronary artery. And on this side is a normal left main stem here, the front artery, left anterior descending, and the back artery here on the left-hand side called the circumflex. This is how the arteries work. And your heart is constantly beating 100,000 times a day. The slower your heart, the longer you'll live. So you're fitter if your resting heart rate is 50 to 60 than if you are 70 to 80. So it's good to have a resting heart rate that's slow. The heart is the only organ in the body that receives its blood supply as a muscle when it's relaxing. Every other part of the body gets its blood supply when the heart is pushing and pumping to give extra blood to it. It doesn't get its blood supply then. It gets its blood supply when the heart is relaxing. And so another aspect of why yoga is so powerful is because it helps your heart to relax better. It helps expiration time, breathing out time, to be longer. And that's when the heart is at its most receptive of good blood supply. And often after a great session of yoga, your blood pressure will have dropped by 20 points because you're just so relaxed. And that's why it's good for you. All types of yoga, breathing yoga, movement yoga, sweat yoga, very active postures yoga, high pressure yoga. So that's a normal angiogram. This is a CT coronary angiogram. It's not as perfect, but if you're below the age of 70 now, the technology is so good, it's 90% similar. And you'll hear from Nishad that he said that we didn't find all three blockages until we did the invasive angiogram, but the CT coronary angiogram gave an indication that we needed to go on to the invasive. But now you can do this one without any catheters inside you, and it's great for people up to the age of 70, unless you've had a lot of high blood pressure and a lot of diabetes, in which case there's so much calcium on the outside, we can't see through it. And so the invasive angiogram is necessary. And this is a typical stent going into a blocked artery. We push a wire through. Along that wire, we open up this chicken mesh stent with a balloon inside. And then the chicken mesh stent, when it's expanded, stays there. The balloon and wire come out, and we've stented that artery open, and the blood will heal inside and form new skin inside that stent. And our stent technologies are so good now that we even have anti-cancer drugs on the inside so they don't overheal and block the stent. And that sort of technology is so successful that most of the time we can do this when the vessels are big enough and easy enough to approach, but we tend to avoid doing it if you've got 3 artery blockages, because a lot of stent work, even though there's only a 5% chance in the first year it will block up, if you've got multiple stents in, there's a high chance, and really we want you not to come back for 10, 15 years, possible never to come back. Punnett was 11 years. That's exactly the average that we would expect from stenting. And he had to have new areas stented because other areas started diseasing. But he did really well to delay that for 11 years. Stenting, we say the results are about 80 to 90% for 5 years. You're not likely to come back. But with bypass surgery at 7 to 10 years, again, it's 50% unlikely to come back. Less than that, 5 years, 95% not likely to come back. So we do need to know about how long you're wanting to live, how well you're wanting to live, what you're planning to do. We do need to know who you're looking after. It helps us a lot to know if we achieve this, you're going to go around the park 3 miles a day and you're going to hit 8 to 10,000 steps a day. That's what your target is. Or if your target is, look, I just want to be able to get 1 flight of stairs so I can get on a plane for a holiday. Yeah, we need to know about these things. This is an angiogram where the left-hand side picture is showing a blocked artery. We can see these tight blockages just around here, and with very tight blockage around here. And this is not even the tightest. We can have complete blockages here, and the wire has been pushed through and a stents have been put in. And look how much better it looks after the procedure than before. And that's successful stenting. With bypasses, we put new branches. So if we cannot put a new branch down here because there's disease down here, then stenting is better. But if we can put new branches beyond the blockages and the artery is big enough to stitch a new vessel onto, then bypass grafting is possible. But there are some times we can't do either. So rare, 15, 20% of people, and it will be medications and exercise and willpower that is the most important thing. So this is an echocardiogram. That's the ultrasound of the heart looking at the strength. I've told you about the arteries of the heart. The muscle of the heart also is important. How much has been damaged with the previous heart attack? What areas of the muscle are going to pass the electricity on, and how well is it moving that electricity? There are over 1 billion cells in the heart, and all of them play as one orchestra exactly in time. And any one beat missing that, and you get extra beats, and there is the chance of lots of extra beats and you collapsing and needing that defibrillator to shock you out of that, because your heart is now going at 180 beats a minute instead of 80 beats a minute, and you could die. And that's a rhythm disturbance called ventricular tachycardia. There are other ones, such as atrial fibrillation, where the top chamber of the heart up here is going 300 beats. And so the blood doesn't move smoothly through the heart. And so you get clots in the heart, and that can cause you strokes when those clots then go to the brain, or they can go to the kidneys, or they can go to the legs, or many other areas. And so the blood flow, the rhythm, the electricity, the muscle, the arteries, and then we've got the valves as well. So here are valves that open and shut. This is a lovely valve that moves like this. It opens and shuts, just like Tower Bridge, up and down. And it has to open and shut a door 100,000 times a day. And it has to not leak or not get blocked. And if you get rheumatic fever, then of course that gets diseased and it starts calcifying early and will start blocking. All of these things, and this is a classically beautiful picture. Look at that. That's muscle. That's valve. That's the collecting chambers. These are vessels coming in from the lungs and from the body here. There's electrical fibers, and there are vessels of the heart itself. So all of these aspects, this beautiful engine, the best design engine in the world, not only contracts, but also has to relax properly. So there are 2 types of weak hearts you can get. Those that have been damaged and are bigger. Can you see how big this heart has become on this side? See how much bigger that is than this one? And that's become dilated. that's not likely to be as efficient because it's been under pressure for so long, either due to high blood pressure or a valve problem or excess alcohol. Even stresses, a really bad stress, can throw so much adrenaline into your system that for a short period of time, a few months, it can stun the heart so it doesn't work properly. Or you can get multiple heart attacks that will also weaken that heart and make it bigger. And so that is a weak, contracting heart, but you can also get a stiff, not relaxing heart. And somebody asked the question, how do we make these heart attack hearts stronger if you've got a weakened heart? Exercise is always very important, but we now have 4 major medication classes. One's to reduce the adrenaline called beta blockers. How many of you know about bisoprolol or have been on it? Bisoprolol slows the heart down, lowers the blood pressure. Yep. How many of you know about ACE inhibitors like ramipril and lisinopril and enalapril to lower your blood pressure? Yep. So lowering blood pressure, slowing down the adrenaline surges, calming down the electricity, beta blockers, ACE inhibitors. Then we've got agents called potassium increasing, we call it mineralocorticoid receptor antagonists. You'll know them as spironolactone or eplerenone. And what they do is not only help the heart pump stronger, they also keep off spare fluid, particularly if you've got spare fluid in your stomach, which is called ascites. The right-hand side of your heart is weak. It's not moving the blood through the lungs. It stays in your legs and your stomach. You'll be on spironolactone. It's not just a diuretic. It's better than that. And so those are MRAs, mineralocorticoid receptor antagonists. And the last and most amazing class of medications that have arrived in the last 7 or 8 years, how many of you have heard of empagliflozin or dapagliflozin? And these are medications that make you pass sugar out into your urine. So they make you lose spare sugar out of your urine. And what that does is it first of all makes you lose weight. Amazing. It reduces your blood pressure. Amazing. It reduces salt and water in your body, lowering blood pressure again that way. But the most important thing it does, by removing spare sugar from your urine and spare water, what other condition does that? What makes you lose water and lose calories? Perspiration exercise. There you go. What SGLT2s, these medications are called sodium late glucose transportase inhibitors. What it is exercise in a pill. And these medications simulate a condition called ketone body metabolism. They're getting rid of all the sugar in your body. So what they do then is they start burning up fat. You're exercising. And when the heart realizes that, guess what? It becomes more efficient. And the reason 2 weeks ago, how many of you saw me at the Pure Soul Jain conference and convention and 2-day extravaganza where people like Nehal were dancing and singing to Mahavira's stories? How many of you were at the Pure Soul Jain exhibition? Any of you? Exactly. What was the talk I was giving there? I was talking about fasting to live. Intermittent fasting, or the type of fasting we do, what does it do? It simulates ketone body metabolism. After day 3, you get the headaches. Your whole body starts slowing down. Your mind becomes much clearer. Time slows down. You're aware and connected to everything. Isn't it funny that all of these incredible old Jain technologies like yoga and fasting are now the same things that are turning up in our medications to slow your heart down, reduce adrenaline, to simulate fasting, to get rid of your spare weight. And the only reason these technologies need to exist is because sometimes we've forgotten our old ways. We've given up our amazing technologies for the fast foods, the fried foods, the quick foods in the stress of modern living. And going back to your basics is another aspect that's in your control for how to strengthen your heart. It doesn't matter that your heart has a low ejection fraction, beating strength, less than 40%, as low as 15%. You can have the weakest hearts. And I've got so many patients with the weakest hearts, and people would look at their results and go, my God, this person's likely to die in a year. And I say, what are you talking about? That's their 7th year now. And they're here 7 years later because they've listened to that one instruction. Of course, all the medications, of course, all the awareness, but that one instruction, you will reach 4,000 steps a day. You will walk around that park. You won't care about the weather. And if you're really smart, you'll get a treadmill at home, like Nehal's just got. You will get a treadmill at home. You will do your sports regularly without fail. And you will take your partner with you and your family with you. And this is why COVID, for some people, was an amazing time, because they reconnected to their old ways. So I'm going to stop to take lots of questions and answers, but I've explained to you, yes, there's incredible technology behind fixing the heart. And there's only one difference between fixing this engine and the engine when you take your car for an MOT. What's the difference? That car is every day. This is rare. What else? One's much more expensive. Depends if you're on the NHS or not. That's right. The car is more expensive. Yeah, quite right. You can choose to have a car. Absolutely. You can't choose not to have a heart. That's right. Actually, there's another joke. There's a guy in the garage and he goes, I'm just about to fix your Porsche. You know what? I think I'm doing a better complicated job than you are, he says to the heart specialist. And the heart specialist says, yeah, okay, you're going to fix my car. I tell you what, let me switch it on and you fix it. And we're just blessed. We're lucky that we've got this beautiful technology. We're lucky we've got these. The time is now, as Nishad has said. I'm lucky that you're listening to us and you've arrived today to accept some of these. We're doing amazing research. We've got amazing technologies. We've got amazing pieces of kit. You've pushed us to have it. You've demanded that from us. We're lucky that you've asked for all of these things. And that's a good thing. You're open, you're sharing. But what I really want you to take is that the best treatments are in your control. I'm going to stop there. Thank you so much. Bring my panelists on board. Come on up, guys. You're welcome to bring your partners with you if you want, because they could answer just as many questions as we can. That's so sorry. Not bad. Completely forgot. Let me take this.
Testing. Anybody going a question? So please come in the front and ask questions here, because that everyone can hear about the live so please come forward and do ask your questions. And any questions, yes, on YouTube as well, feel free to come and ask them.
So we have a couple of questions on YouTube.
Join us. Just while you're doing that, one of the things I'm going to say to you, the reason we've got Nehal up here as well as a optometrist and as a eye specialist is we've just designed and proven, and he's known this for many years and decades, that by looking at the back of your eye, we can predict who's going to get heart disease with 90% accuracy. It's all in the eyes. It's all in the brain. He's been saying that. He's known that for ages. Blood pressure, cholesterol, sugar, diabetes, all of those changes come in the back of the eye. And so actually cardiovascular risk factors are the same risk factors that cause eye disease. They cause dementia, they cause strokes. And actually we're finding that those people who have heart disease are more at risk of cancer. It's a triad. And those people who have cancer treatments are then more at risk of heart disease because of the stress, not only of the diagnosis, but also of the treatments and the risk factors that led to them sometimes having cancer at an older age. Younger cancers are different, but the older age cancers. So it's actually useful to have you here.
Thank you.
We have a few questions on YouTube. I'll start that off, but please join us up here as well. So the first question was, I've been diagnosed with heart failure now after having an MI in 2003. How can I improve my quality of life? Shall I read out the rest or?
Is that one working as well? Oh, good. So you can use that one and we'll use this one. So to strengthen a weakened heart, I've told you about the 4 classes of medications. We also need to fix any artery problems if you have artery problems. So we unblock arteries and then more blood to the areas that are still alive. We also have specialized pacemakers that will make the heart beat in time with each other. There's 2 sides of the heart, the right side, which sends blood to your lungs, and the left side, which sends blood to your body. And by making the 2 balloons shoot water out together simultaneously, we strengthen the overall amount of blood coming out of the heart. We say they're 2 balloons, 2 sides of the heart. So we can put pacemakers in to deliberately strengthen the heart. And then it's exercise. It's also good sleep, and it's also good emotional awareness. Tell me about the role of exercise and helping you recover from that depression, that anxiety, the healing. You're here at 3 weeks healing. The bones take 6 weeks to heal. You've already started some exercise. What are the power of exercise, guys?
Ameet, shall I give it to you first?
From my point of view, you know, it was something that I used to do a lot, and then obviously I kind of gave up in the middle. But as soon as I had a heart attack, I had to bring myself up to it again. And as you said, that's the time. We're now on our 3rd treadmill at home, right? So we bought our first treadmill within the first week of me having a heart attack. And I still remember going on the treadmill and just being able to walk on it. And that was it. And now we run well, about 3 or 4 times a week, 5K on it. Right? I mean, it doesn't have to be strenuous exercise. You can take your time to do it. You don't have to, you know, be the Kenyan cross-country runner. But it's important to keep that up. Well, I think she has to kick me on it. But yeah.
And I think I'll be completely honest. I've never been one for sports or exercise in the past. But, you know, over recent times, what I've noticed is walking or anything that actually suits you, which gets you moving about, because Ameet just mentioned recovery time. So yes, if you have open heart surgery, they pull apart the ribs and they clip them together again, and they need to heal. And it's extremely painful. However, one of the most important things is the lungs. So the lungs, if they're sitting at rest and you're lying in bed for too long, they're going to accumulate muck, liquids, etc. But by the simple process of sitting upright, and as soon as you can, moving around and walking around, you know, I was told to do 30 laps of the ward. It wasn't a big ward, luckily, but you could feel the lungs clearing themselves. And that's what certainly helped.
Flow is everything. Now, exercise?
I didn't realize that it was going to be putting me on the spot there. But about 15, 20 years ago, when I first heard Amit talk, actually in a Jain forum in Young Jains, it really captured me. I felt I gravitated to whatever he actually said. Little did I know at that time that I'll be on a path of discovery in terms of exercise. Because if you are a friend of Amit's, one of the things that you will know as well is that you will always be talking about eat less, exercise more. And subsequently, I think with any of his friend circle, he's changed lifestyle for everyone into exercise, exercise, and exercise. So when you get a call from Amit, first you have to be ready. Monday, badminton, Tuesday, squash, Wednesday, treadmill. And then he says, okay, fine, you've passed the test. We can talk about all this stuff now. So that's the importance that he really gives to exercise. And I think I've made that my lifestyle such that without it, I start to feel uncomfortable. And I think it is important to make exercise a lifestyle and enjoy it as much as we possibly can. We have table tennis going on upstairs right now. And the first thing I would say was, are we playing table tennis as soon as we finish the store? So we must make exercise our lifestyle to a point we enjoy it. It doesn't have to be always running. It could be table tennis, badminton, walking. Make it a part of your lifestyle. Our bodies are not designed to be sedentary unless we're sitting in yoga or something of that sort. Our bodies are designed to move. So make sure that they move. And being part of Echo Center here, like Oshwal, we're always moving and always active, and lifting chairs is a great bonus for us. Doing the physical work that we do is a great bonus for us. So all the people sometimes might think, oh, wow, you guys are working hard. For me personally, it feels like I'm doing exercise. And in the back of my mind, I'm thinking, Amit's going to be happy with me when he speaks to me next. So do think about making exercise your lifestyle.
So the next question, I'll read two out. Coronary calcium scan or the heart calcification scan. Is this something that can be done by all? It's certainly not available in the NHS. So any recommendations on what tests can be done by an individual to detect early signs of heart disease?
And Nishad also mentioned it's important to understand calcium, good calcium in your diet, and it helps your bones and so forth, and bad calcium that builds up in our arteries because our blood pressure is high and our flow is poor. So calcium is like a river flowing slowly. If it's slow to flow, it will silt up the sides. It's okay to have lots of things inside the river flow as long as it stays there. So it's good to have calcium there because it will go to your bones. It will actually build and heal lots of things. But once the flow starts slowing down because of tortuosity of high blood pressure, that's when the calcium will start getting into the vessel walls and start blocking things up. And so the first thing we look at is how much calcium is inside your arteries. A score of 0 or less than a few hundred is brilliant. Score of 2,000, if you've got lots of calcium blocking up all the arteries, there's bound to be lots of blockages underneath. And the reason the CT coronary angiogram isn't something that's openly given to everybody is because there's a number of degrees of blockages, less than 50%, for example, that, okay, we need to know about it because we want to prevent it getting worse, but we don't want everyone constantly worrying, oh my God, when am I going to have my bypass? When am I going to have my stent? You only need to have unblocks if you have a blockage more than 50%, causing the heart muscle to genuinely not get its blood supply during exercise. And so doing routine scans exposing you to radiation unnecessary. They're high radiation scans, the equivalent of between 40 and 100 X-rays. And so we wouldn't want to do that routinely all the time for no reason. So we say a very simple way of knowing if you've got heart disease is, can you run up 2 flights of stairs without breathlessness? Can you recover after exercise back to your resting heart rate really quickly within a few minutes? The faster your recovery time after exercise, the healthier you are. The slower your resting heart rate, But then we go on to the symptoms. If you're getting chest pain, if you're getting pain in your neck, pain in your arms, a sense of discomfort, a bear hug, if you're getting breathless or dizzy or lightheaded when the heart races and it starts missing beats, those are called symptoms. And that's when we will start investigating you with tests. It's always a little bit of tension between, hang on, I'm getting to the age of X, why don't I just have a screening test, versus is it worth that screening test? Because some people will psychologically freak out by knowing they've even got 30% or 40% blockages. And so there's got to be a balance between, hang on, let's look at the right time that you're ready to have interventions and treatments and medications for the rest of your life, versus not missing it because we've done it too late and you've ignored your symptoms or you didn't realize those symptoms from the heart. So sorry, it's a slightly long answer, but yes, exercise, your ability to exercise is not just, there's a little bit of interference somewhere. So my reason for telling all my friends to exercise is a twofold increase. Number one, I want them to live longer. But number two, during exercise, they're more likely to pick up the symptoms. And then I know we need to act. So there's a little two reasons I haven't told you. That's the other reason, buddy. So the second question would be, if you said, I'm no longer exercising, the next question would be, why not? And then when you say, well, I'm getting breathless, or I'm getting fatigued, or I'm getting excessively tired, that's when we go, okay, is it the heart, lungs, or are you unfit? Thank you.
Yes, that's right. And Prabhupada Bhai was, I'm sure Prabhupada Bhai will have a question, and then we've got one. If you just come forward on this side, we'll just make a tiny queue, if that's all right, so that we can have one question after the other, if you don't mind. Yeah, the other mic's not working, so please do come and use this.
Some time back, somebody sent me a catheter. A video, and they say by inserting a catheter and sucking this sludge which was blocking the artery. So how far that is true? And somebody from India, surgeon, they say that it can be cleared without inserting stent or anything.
Within the arteries, there is blockages that occur over a long period of time. And those are quite thick blockages. And then what happens is a sudden event ruptures a plaque. So there's a buildup of plaque inside the artery. And then a little gap occurs in the little mountain. And what happens is blood goes inside the little hill and makes the top of the hill fall inside the blood vessel itself. And so a new, fresh amount of clot arrives that is really early clot. So imagine a snow when you're skiing or you're going down a street, etc. And a lot of people have got sludge on the sides, and that's quite tough sludge. But when somebody falls down and a whole load of people block up behind it, that's just a fresh clot. And fresh clots we can suck out quite nicely. We can either suck them out, we can drill through them really easily. But that doesn't sort out the underlying 50% blockage that was there before the next 50% came. And so clot extraction is something we do if it's all fresh clot. But most of the time it's not. 95% of the time, you've got underlying thick blockages that need the stents, need the bypasses. Now, there are evolving technologies all of the time. So if you have 100% blockage, we actually have diamond drills that can break through one side or come backwards and break through that side, but then we still put stents in to stop it coming back. So those sorts of videos are really quite unnecessarily provocative. You shouldn't really be spreading those around. You shouldn't really be looking at those. If you want to know, the NHS source, British Heart Foundation, is a fantastic resource. The research on there is always up to date. We've got some of the most futuristic research. And so we will tell you exactly what's going on in the NHS when the National Institute of Clinical Excellence approves something, when the British Cardiac Society approves something, the European Cardiovascular Society approves something. If we send you something through those three mediums, that is bona fide. But when other people send you sensational things, please resist the urge to keep sending it to each other as if this is the miracle thing that's going to make the next thing through sliced bread. Those things are really engineered. There are little pieces like fresh clot. We can extract that. We've been doing that for 15, 20 years. And yes, that technology is there. It's not the first time somebody's done it on a human being and it's like, wow, that's a miracle. So there's a lot of, we're using media in a way to raise awareness, but sometimes that can be quite provocative. So just be sensible, be cautious, don't overhype. Look it up on the British Heart Foundation site. Does that exist, etc. So there's ways of not getting misinformation. And we did a lot of that during COVID to remove the fears of vaccines. Yep. Thank you so much. And we've done that.
May I abajo mic camera? Some abajo.
That's the state which you insert inside. Is there any time how long it can stay safe for the life of the stent?
Stents, once they heal, as I said, there's a 95% chance that 1 year it won't block, so 5% per year. And it only blocks inside because we overheal sometimes. We overheal. So it's an insult, deliberate insult to the artery to stretch it, and then we put the stent in to support it, recoiling so it doesn't bounce back down, close down. They can stay forever. And we've even got stents now that will absorb away after 5 or 6 weeks. So they do their job and then they melt away into the wall. So there's lots of stenting technology. It's 20 to 25 years old now, and we're getting better and better at how to create stents that do their job and then even dissipate.
Thank you. Thank you very much.
Let me ask someone else behind wanted a question. How long do valves last if you've had them replaced? Was one. Hand over to.
So metal valves, I probably won't need it. When we put, no. even for that, I promise you, it will get through. Metal valves will last 20, 25, 30 years if they're really well placed in the aortic or mitral area. And these metal valve technologies are over 50 years old. So they are tilt disc valves or ball and cage valves. So they'll last a lot longer. So we often use those for younger patients, but the technologies are evolving all the time. So our newer technologies where we use cows valves or pigs valves, etc., those are likely to last between 15 to 20 years, slightly less, but they're less likely to need blood thinners like warfarin in the old days. Even now, we still need warfarin if you're on a metal valve, and the bleeding risk from the warfarin has a problem. So it can cause 0.5% per year risk of a bleed in your brain. And that's why we try and avoid those for people that might be at risk of strokes, etc. Yeah. So even those tissue valve technologies, we've now got synthetic graft valves, and we don't know how long they're going to last because we've only just started inventing them and using them 5, 10 years ago, and they're doing great for the 5, 10 years that we've seen them. So ask us in another 30, 40 years because they may last longer than metal valves. But the first technology that was really successful were the metal valves. And so we know, are really good for between 25 to 30 years.
Hi there. Ameet, just a bit of guidance, really. How does myself and my wife do a full MOT on our heart? Okay. I spoke to my wife last summer and I said to her that we're coming to an age that I think in 2023 that we should have hearts checked and the arteries checked. And the reason that I came this evening is when I heard that you're coming to give a speech. Okay, so it just all the well. So just a general guidance.
Nice answer for you. So most of our black cab drivers and professional drivers have to get their DVLA license renewed every 1 to 5 years. And they go through a treadmill test. They have to do 9 minutes on a treadmill. And they have to reach something called over 90% of their target heart rate for their age. And if when they do that, their ECG, their blood pressure, their rhythm, and no chest pain, everything's okay, That's about 90% as good as it gets without doing more aggressive tests. Now, a lot of this depends on how much security, certainty, and absolute probabilities you as a person want. For some people, knowing 90% that they're likely to get through the next 5 years without a problem is good enough. Good enough for their licenses, good enough for pilots. Now, pilots have to get to an even higher level above a certain age, and they need to be 98% secure that they're going to get there. And so if you then decided 90% isn't good enough, yes, I did 9 minutes on the treadmill. Yes, I got a 90%, but I really want to know. We would say, okay, let's find out why you really want to know. And if you said, actually, my family history is that everyone drops dead at 50 of a heart attack, then we go, okay, let's have a look at your blood test. My cholesterol is bad, my sugar, great, you get a CT coronary angiogram. Now, if you had symptoms, you're more likely to get those tests earlier, very quickly, rather than having to wait till you reach a risk issue. So there are 3 ways to think about this: symptoms, family history, and your biomarkers and your stress testing component. Yeah, does that help?
No, right. Okay. So Ameet, well, hold on. Ameet, what you said was taxi drivers go and have a treadmill test. Okay, who does the treadmill test?
So cardiologists do the treadmill test. We
Okay,
interpret those
yeah,
results.
okay. So how do I go about getting a treadmill test?
So if you wanted to know how fit you are and whether you had safety,
Yeah.
you would ask for a treadmill test. You would say, I want to be referred to a rapid access chest pain clinic. Now, the NHS doesn't say if you've got nothing wrong with you, we'll give you a treadmill test
Yeah.
just because you fancy it.
Right,
That's
okay.
that's the one problem with the NHS. Yeah.
Okay, and
At the moment,
yeah, okay. So, okay, let's,
remember, our ability to make the NHS evolve is in our hands.
okay, fine. The NHS are going to say no. And so what's our next step if I want to do it privately?
That's fine. You just ask for a referral to a private cardiologist to get a
Right,
private
okay, fine.
exercise center.
Yeah, right, fine.
Yeah.
Okay, yep,
A
yep.
lot of people will, of course, go to India and go and walk into a hospital and get those
Mhm,
tests done.
Right, okay, fine.
We
yeah.
don't, it's hard for us as NHS clinicians to say everything should be free of point of expectation
yeah.
for everyone at all times. Yeah,
Okay,
so
yeah, yeah.
because there's a gradation of risk.
Yeah, okay, understand. Okay, fine.
All right.
Okay, thank you very much. Thank you.
But the exercise test, if you're good at exercising, you will already be sensing if there's a problem with you.
Yeah.
Yeah. Would you say to me that your risk factors, you have a good sense of your risk factors? By the way, out of interest, even when you go for life insurance, a lot of people have tests just for the life insurance.
Yeah.
do
so
you
the question
feel-
is- What's the question?
What is your intuition of your fitness?
No, I'm very fit, okay. But I want myself and my wife just to get checked out. I had an organ transplant 4 years ago, okay. But I just want to get it more than 90%. I know we're gonna pass the treadmill test.
Got it.
Quite comfortably, okay. But I
Yes.
want that.
Actually,
that
you've just said
calcification-
something really fascinating. Are you on medications to suppress organ
Yes,
rejection?
yes, of course I am. Yes.
So guess what? You are at 5 to 6 times higher risk
Yeah.
of getting artery problems
Yep.
than anybody else
Yep,
because
yep,
of those medications.
Yes, yes.
If you had been at a certain age, we'd have done the angiograms and stress tests even before giving you the organ transplant. And if you had the slightest bit of risk factor now, you would get those tests
Right,
because of your organ transplant,
right, okay.
interestingly.
So you're saying the tests were done prior to my surgery?
They would have been done prior to giving you a transplant,
Right, okay,
correct? In
understand.
fact, the number of people that go for kidney transplants and they end up having bypasses because we found coronary artery disease
Yeah.
and they have to have that before they can go through their transplant.
Okay, so are you saying it's a waste of time?
Not waste of time. It's only a matter of time before you'll need them again
Right, okay.
because you're more likely to get artery disease earlier. But it's usually 5 years. If I did a test on you today and it showed a CT coronary angiogram and it showed no significant blockages, it's pretty good for 5 years.
Yeah.
Yeah, unless something else has changed in those 5 years.
All right, thank you.
Great.
Thank you. Ameet.
That's all right.
Sorry.
That's all.
Absolutely no problem.
But please, if you just come forward.
Thank you, Ameet, Puneet, and Michelle, for your wonderful presentations. My question is simple. Aspirin. Normally, people sometimes are given 75 milligrams aspirin to take. Puneet, you probably would know that in your dental surgery, in your emergency cabinet, you would have 300 milligrams tablets. Was it one given to you when you had your in the surgery? Yeah.
So that, one of the things that I said was, if you now have a cardiac event in a dental practice, you will not be a priority for the ambulance, because we are expected to have all the equipment there, the defibrillators, the oxygen, the medication. We have small packs which tell you exactly what to do in case somebody has a cardiac arrest. We have regular yearly ILS, BLS training, basic life support for the whole team. So everybody is well aware with everything. And the day I did, remember I said the nurse knew what was happening. And as soon as I fell down, the first thing she did was smack 300 milligrams of aspirin down me. Right. And that was part of the reason I stayed awake. Well, I didn't stay awake, but I lived. And so, in dentistry as a joke, because we see a lot of patients, we say aspirin is Smarties. Yeah. And we see, I'm sure so many people take aspirin. And I think it's great. But yeah, that's what happened.
No, as well. Yeah. So my question is for Ameet, would you recommend or advise people to carry around 300 milligrams of aspirin?
Nice way. This is the power of prevention. You're absolutely right. 300 milligrams aspirin. I always know where I can get a hold of aspirin in my house. I haven't got it in my car, but then most of the time I'm working in a hospital. So absolutely right. So 300 milligrams of aspirin for emergencies, really simple. Bayer aspirin is over 50 years old. So 55, 60 years old. And Bayer became one of the richest companies because of aspirin. And there's two ways to take the aspirin. 300 milligrams as an emergency in a situation that you suspect a heart attack or a stroke. And also 75 milligrams once a day, once you've had an event, a stent, a bypass, you'll often be on it. Or if you're above 10% risk in 10 years of death, stroke, or heart attack. One of the websites I want to give you is called QRisk, risk.org. I want you all to go to that, qrisk.org. You will need to know your blood pressures. You will need to know your total cholesterol to good cholesterol ratio. You'll need to know your family history of anyone below the age of 60 has had a heart attack. You'll need to know what medications you're on, whether you're on diabetes or blood pressure medication. Once you put that in, that will tell you your 10-year risk of death, stroke, or heart attack and what your heart age is. And if it's above 10% likelihood of death, stroke, or heart attack, we will put you on 75 milligrams of either aspirin or the newer aspirin, clopidogrel.
Thank you. So under what circumstances, if somebody was carrying 300 milligrams of aspirin, under what circumstances would you tell them to take it? When would they sort of signs or symptoms be?
So we suspect you're having a heart attack if you've had bad chest pain for more than 20 minutes. So if you're having strong chest pain, it's taking the ambulance too long to arrive. At 20 minutes, you'd say, take the aspirin. Yeah. Usually in London, the ambulance will have arrived within 20 minutes. They'll have done the ECG. They'll have found out what's going on. If there's abnormalities in the ECG, they'll give you the aspirin. They may even give you clopidogrel, depending on how far away from a cath lab you are. If you're close to a cath lab, they won't give you the clopidogrel. They'll just give you the aspirin.
Thank you.
Pleasure. The power of prevention. Good question. Sure.
Ameet, there was one question from the audience. Is there any such thing as keyhole surgery when it comes to stent implants? Anything?
Yes. So keyhole surgery. So all of our stents go through tiny little catheters in the wrist or in the groin. So that's already keyhole. It's local anesthetic. So that's one type of keyhole surgery. There are two other types of keyhole surgery. We are now able to go through the larger vessel in your groin or sometimes through the arms, etc., and put in valves. We can actually undo the bad valve, deliberately break it, and put a new valve in, and it's called transcutaneous valve replacements, aortic valve replacements, TAVIs, valve interventions, etc. We can put mitra clips. We can actually put little paper clips, literally like staples, deliberately inside. We can close holes in your heart through that keyhole technology. And then there's one other type of keyhole surgery where instead of cutting you down the center of your chest to open the whole chest up to put bypasses in, we can do micro pushing these ribs apart. And if we only need to do one artery bypass, the front of your heart, we can move the artery at the back of your chest that supplies your breast with blood. We can move it from the back of the chest wall to the front of the heart while it's still beating through micro mini mid-cab surgery, just pulling the ribs apart and getting enough space to do that. We don't have to completely break the chest open, the sternum, and cut through it. And we do that under general anesthetic, but it is beating heart surgery. So your heart is beating even while we're putting a new artery onto the artery. So those are the three types of keyhole types of surgery.
We're going to finish off in about 4 minutes, 3 or 4 minutes now.
So let me give you 3 questions. One from me. I had a stent put in about 8 years ago. I was discharged straight away. I've not been back. So what's the advice? That's one question. The second question, up to you.
So normally after you've had a stent, you will usually have an instruction when to stop the second blood thinner. So usually the second blood thinner used to be, you'll be on 12 months of aspirin clopidogrel, then we'll stop the clopidogrel at 12 months, you just stay on aspirin, etc. We now have the ability to change that advice. We can go from 1 month to 6 months, sometimes for 12 months, sometimes for 2 years. So there'll be that sort of instruction written on the sheet. The second thing is, if we have left some other blockages open, we sometimes, in the heat of the middle of the night, we will firefight and deal with the main vessel, but we may come back to do other vessels that are 100% blocked. They're old blockages. We might come back later. So if you only had one area needing spot welding and you're fantastically well and you're going to take your tablets and you're going to do everything we tell you, you're good to go. And you would come back to us very quickly if you had any problems. So that's why you're in the 64% of category patients that do what they're told. We don't worry about you. You don't worry about us. You're smart enough to get in touch with us. You're going to do really well. There's 7% of the population that are really finding it very hard to understand the disease and treatments, and they're really scared of being medicalized and they've got other priorities. We leave them alone. The other 30-odd% are the ones that need a lot of help. You either don't understand or recognize the disease, or you're worried about the therapies themselves. And so you might not do the right thing, stop smoking. You might not do the right thing, take exercise. We will always invite those people for more appointments and cardiac rehab exercises. Everybody, if invited to cardiac rehab classes, just as Punit was, I'm sure, invited to cardiac rehab, just as Nishid would be in a few weeks' time. Take those exercise classes, take the cardiac rehab classes. You can even have those even if you've had a heart attack a year ago, 2 years ago, you can be invited to cardiac rehab. If you have a weakened heart and you want to be in a safe place to exercise for a few weeks before you go outside, etc., you can be referred to cardiac rehab. It's a really good program, teaches you about psychology, food, diet, medications, and most of all, you meet like-minded people who are going through the same thing. The power of sharing, as we've alluded to before, meeting other people in the same boat is so powerful. We don't really understand how great those technologies are, but we know that cardiac rehab leads to better outcomes of less deaths, less strokes, better recovery time, better medication choices, and less likely to see me again. Yeah.
So the next one's going to be easy. The advice often given is 8,000 to 10,000 steps a day. Doesn't your body get so used to this level and the benefit diminishes over time?
It's a really nice question. Somebody smart. Who put your hand up? Who put that question up? Okay, well, whoever on YouTube asked that is good. That's the way I want you to think. And the answer is no. The heart is beating how many times a day? 100,000 times a day. You get it down to 60,000 times a day, you've reduced its workload. It's always going to be happy. If you get it down to 50,000 times a day, even better. Yes, you can push yourself harder. At that point in time, when you're really healthy, it isn't necessary to be more healthier, because you'll take risks with your joints, you'll take risks with the pollution, you'll take risks with not checking, and you'll twist yourself. And what will happen is you'll sprain your ankle. Something silly will happen if you overdo it. There is a balance. And then you'll stop exercising for 4 to 6 weeks. And guess what the most dangerous time is? When you restart exercising, thinking nothing's happened to you, and that you're a young 25-year-old, you go straight back to 10,000 steps. And actually, guess what? Your body's not ready. Your heart may be, but your body's not ready. Other things will go wrong. So what we want is sustainable resilience, not overdoing it, over extreme, sort of responding or overreacting to something. Even in the stents, we say, don't overreact on the healing. And again, we say, don't overreact to the things that have happened in your life. Take it in moderation, as you said, Punit.
So last question, again, online. Actually, I'll let you read it because I can't even pronounce it.
Which one is it? Empagliflozin? Yeah, can empagliflozin be prescribed in primary care? It's used in the treatment of diabetes without known heart disease. So the medications I talked to you about, exercise and a pill that make you pass sugar out into your urine, if you have diabetes, it can already be prescribed by any primary care practitioner, diabetes nurses and pharmacists with an expertise. At the moment, it is said that you need to be a heart specialist to start it off for heart problems. But my role is already to educate GPs and pharmacists and nurses to not have to wait, because NICE has not caught up with the benefits. We're saying if you've already used it 4 or 5 times in diabetes, you're an expert in that area, you're well and more expert enough to prescribe it for heart disease. So I'm encouraging GPs, nurses, and pharmacists to get on with it. So I'm going to give the last word to our youngsters here. I want them to answer that question that we put at the beginning. How do we as a network move from reactive medicine to predictive medicine? Will be your question. How are you going to avoid that third set of stents and arteries and bypasses? And more importantly, should you not check and look out for your partner having those same risk factors as you? Be aware for her. And then the question for you, you've been given second lease. What do you want people to work on now? You've talked about the emotional side and that post-traumatic stress syndrome side. How are you going to work on the mind-body relationship? Over to you guys.
Just put us on the spot again. I'll answer it in reverse. So I'll start with the family first. And to be fair, it won't work if you just do it by yourself. That's the bottom line. It's got to be an effort throughout the household. Priya read something called the China study, right? Which talks about how and why we get heart disease. We go for walks. We want to go out for dinner. We'll walk to the restaurant, have dinner, and walk back. I'll let her speak.
Sorry. Hi, everybody. I just wanted to share, it's teamwork, it's progression. We are where we are now, and it's work in progress all the time. But answering your question earlier, the gentleman there about Ashraf, about tests you can have done. I've recently participated in a research program. I don't know if you're aware of it. It's for British Asian people. They're looking for 100,000 volunteers. I went along to the Shayona Mandir, and they have a room there. It's kitted out. They do an ECG, they do retinal scan, they take your body metrics. You fill in a whole questionnaire and they give you a report back. You know, it's hard to get hold of a doctor these days, but, you know, just being aware of what's going on in our body, contributing to research, and you get feedback from it as well. But if anyone's looking to sort of get a bit of an MOT done, I think that might be a nice place to start. So I just wanted to share that.
This is again so fantastic, because we asked the question, how do we move from reactive medicine to proactive medicine? Why do you think we're doing that study? So that we can answer the question that you originally placed. Why don't we all just routinely have tests at the age of 50 and 60? If this 100,000 study and the 100,000 genome study and our world-leading biobank studies show us that proactive screening is actually cost-effective, the NHS can afford it from the savings it makes on bypasses, the savings it makes on defibrillators, you will be in a not yet NHS, but tomorrow's NHS, which will be a proactive NHS. So that's the great news of that study.
Yeah, and I think if you Google sabiobank.org, you'll find a link to book in for a test there.
Perfect. There's SA. There's even South Asian Biobank. There's even another study from my friend Ameet Banerjee, who's got an amazing grant, almost over £1 million, to work out why South Asians don't use digital technologies to look after their cardiac health as much as everybody else. What is our digital literacy? Imagine those are the sorts of things that the NHS actually invests huge amounts of money to prevent us getting heart disease. Shout out for Ameet Banerjee, he's running for British Heart Foundation president.
So how does one become more connected on an emotional level? I think there's two things I'll share with you. I've been very touched at being here today. And that's because 3 of my best friends are sitting here and I had no idea they were coming, apart from the very kind person who drove me here. I ask you to stand up. And you in the middle. And the reason I say this is, as friends, it's important to have these open discussions, especially if you're men, right? And that's a whole new topic. As friends, it's important to be able to talk bluntly and blatantly about how you're feeling. My cholesterol levels for 10 years, every single year, was either borderline or below borderline. And we'd have that discussion. Should I do this? Should I do that? Guess what? Statins were an option because you're borderline. Now, I'm not going to talk about what medication and all that. The second and last thing I'll leave you with to answer the emotional question is, ask yourself 2 questions. The first question is, why is it important for you to be with here, not here, but in this world in 10 to 12 years' time? Once you've written and thought about that answer, go ask the people that you matter most to the same question. And then figure out what you're going to do to make sure you're here in 10 to 12 years.
Thank you. There was one final question for myself, and I'll just quickly answer it. When you go for an eye test, they take a picture of the back of the eye. Akhno je pachar che eno picture le che. That's the retina. Retina ni pachar ghana bada nerve fibers hoy che. and blood vessels हुई छे तो जे अमित भाई जे बात करता था कि we can detect heart attacks from that. There's a special machine. It's called optical coherence tomography, OCT scans. તમે કદાચ કર્યું પણ હશે when you go to the optician, OCT scan. Just like how you have a fluorescein angiogram, this actually picks up all the blood flow, and then it'll pick up blockage, and that's how they pick it up. So this is the new advancement in eye technology. Can I please invite our Northwest Chair to say the thank yous, and then Prafula Ben to just let you know what's happening in the next few events. So just Jayashri Ben, Northwest Chair. Thank you very much.
Thank you. Wasn't that an interesting discussion and topic? What do you guys think? Big, massive round of applause. Even clapping is good for your health. So I just like to say thank you to Ameet, Dr. Ameet Bakhai. So I've known Ameet for years. I remember once we were talking about an interview. I don't know if you remember it, but I remember it clearly. So Ameet goes, Joe, come on, I've got this job. Let's talk about it. So I thought it was like an interview. No, it wasn't. He took me to the park and he made me walk round and round the park. And he just asked me about questions about this job. But it wasn't like a formal sit down thing. I think we walked about 2 miles that day, Ameet. So yeah, anything you do, I think you have to incorporate, if you can, incorporate exercise in it. So, and the lovely sort of personal stories were really heartwarming and heartwarming, but so they were really interesting. So thank you so much to Dr. Punit Shah and Nishad. Thank you so much for sharing them, because I think when Nishad said there are 3 takeaways, I thought, oh, pizza, chips, but no, I think really important takeaways. I think you really need to think about our health, our heart health. Of course, we don't know what's going on in our bodies. We are so grateful. I work for the National Health, and every day I see what's going on. We are under a lot of pressure, and unfortunately, we can't do all that screening that we would like to. But I think it is our responsibility to look after our health so much. So I think, with that in mind, of course, we at ECTA try and do a lot of healthy things, and we are working on healthy menus as well. But I think, this health fair that's going to come, that's coming up, which is organized by our exec level, mind, body, and soul. And I think it's really focusing on healthy living, not just exercising, not just healthily, but also spiritually. It's all important. As Ameet Bhai was saying, our Jain values are all interrelated. So I'm just going to hand over to Prafula. But just before I do, can I just thank the AV team for YouTube, for all the Bansi, Sanjeev, Umesh. Can I also just thank all the volunteers who set out the chairs and everything? I think they're here. And just quickly, all the committee members that are here, can you just stand up, please? So we got, come on, everyone that's here. I know Bansi can't, sorry. But thank you to the whole committee, because, we're doing quite a few programs for health talks, but it takes a committee to put it together. It takes a whole lot of volunteers to make it all happen. It takes expert people to actually come here. And this is all voluntary time. And I think, we're so blessed to have everyone, here. But most of all, can I thank all of you that have come here on a weekday, and everyone that's on YouTube to log in. I think, that there's always something. I know we hear loads of talks. I've heard Ameet Bhai before as well, but there's always something more that you gain out of coming to all these events. So thank you, everyone. Now, I'm going to hand over to Prafula. Prafula's our Northwest Secretary. She's going to tell you all about the healthy activities. But just before I hand over, you're going to talk about the Derasa, aren't you?
I am, because we have a Derasa upstairs, stairs, exercise. So whenever you come here, please do visit the Derasa. It's a beautiful, serene, spiritual place. Sorry, my voice. We have embarked on a journey, as Joe just said, about healthy living, not just for our physical health, but also looking at our mind and our soul as well. So here at ECTA, we have yoga. You talked about yoga? Yes, you're there. On a Thursday morning, we have about 100 people doing Garba Keep Fit, kindly funded by Brent Council. So we are really, really enjoying that. And I've noticed actually people getting fitter doing that. Believe it or not, Garba, just doing one round of Garba, looks like we're doing nothing, but actually burns a lot of calories. We've got Bollywood dancing classes that happen here on a Monday evening, same thing. This is all about burning calories, getting fitter, but also enjoying ourselves. So I don't know what your park runs look like, but we do this stuff. We have also some lifesaver courses that are being run here regularly. And I think we've trained up over 90 people now. Yeah. So 90 people in the community who have done that course and really, really worth doing. So please do sign up for that. It's completely free. And my last word on this is, you've all said it, you said it, I'm saying it again, exercise and healthy eating. And healthy eating we are going to do. Oh, Umesh has just reminded me, you can volunteer here and exercise. I think someone mentioned lifting chairs earlier. Yeah. So no, I think all of these things that we're doing here is a journey, and the more of you that join that journey, the better really. And our regular events like today, we've got 2 more in the diary. So we've got one happening on the 12th of June, and it's Tower Healing. So we're going to be looking at the ancient Chinese healing of Tower. Does anyone know about Tower? Right. So I'm going to describe it what I understand it to be. Tower healing is actually about what goes on in the sky and the nature around us. And ancient healing in China was all about that and the cycle of the moon and how that affects us. Interestingly, Jainism also talks about this. And so that's happening on the 12th of June. And on the 16th of June, we're going to be joined by an amazing young man called Ramesh Hirani. He's going to talk about obesity, sleep, and reversing diabetes. And this is a completely natural way to do this without medications. I'm really, really looking forward to that, because diabetes is a pandemic. And we really do need to know more about how we reverse diabetes. So please do join us for those exactly the same time as today. We might even serve tea. Oh, tea, I know it was served today. I'm saying we might even serve it on these. So 8 o'clock, and then we aim to finish usually around this time. Thank you for coming again.
Just finally, 260 people have joined live on YouTube. So hello, everyone out there. But to know about all these events, how many of you are on our WhatsApp group, Northwest? If you're not, please see one of our committee members. Yeah, please see Sanjeev, he's our WhatsApp man. So please make sure that you're on there, because you'll get regular alerts, all daily alerts actually, about everything that's going on in ECTA. So the more people that we have, the more information. So it's great. We'll have a lovely, lovely evening. Safe journey home. Thank you so much.